Hello everybody, this is Bradley Grunner, and today I want to discuss the topic of nutritionists versus dietitians. And this is a topic that has been going on for quite some time. I'm sure it's even been discussed before I was even born, let alone before I even became a registered dietitian over a decade ago. Being that I'm involved in the so-called fitness community, this is a topic that I've seen discussed over and over. And it came up again in a very popular Facebook group that discusses sports nutrition. The group actually is the Facebook group for a major sports nutrition society, actually. And like this topic, every time this topic comes up, the thread becomes enormous, with dozens and dozens, if not 100, replies on the thread from various points of view. RDs chiming in, personal trainers chiming in, bodybuilders chiming in, bodybuilders with no academic credential chiming in, which is fine too, as you will see my opinion on the topic later in this discussion. I have no problem with bodybuilders or athletes talking about nutrition. In fact, they should take a large interest in nutrition because, after all, nutrition is a huge part of the game, especially in bodybuilding. I do believe that it is actually very important that an athlete be well fueled and has a good body composition and performs well as a consequence of sound nutrition. But as we know, many athletes have an abysmal diet but succeed in their sport anyway. I think some of them would get an edge if they ate a little better, or perhaps in the cases of sports in which body weight is very important, such as weightlifting, powerlifting, MMA, boxing, any martial art, wrestling. I do think that nutrition, although it might not be the biggest game changer that we would like it to be, I do think that athletes would benefit from a sound understanding of nutrition, because then it would make making weight less miserable, and they can have a better body composition at any given weight and perform better. That's why we see a lot of power lifters actually in the recent decade taking more interest in nutrition, keeping leaner, coming out more muscular. I mean, if you're all familiar with the powerlifter Dan Green, look at his physique. And last I checked an article by him, I can see that he takes nutrition very seriously. So with that out of the way, let's get into the nitty-gritty of the topic. On the one hand, we have people who think that RD should not be the only people in all 50 states. What was that now? Is it 50 states or what is it, 51 states? I get confused since I'm not the biggest expert on geography or the states of our country. But anyway, you get the gist. That all the states of the United States of America, in these states, only RD should be able to give nutrition practice, nutrition counseling that is. And everybody else should be banned from doing so, aside from MDs, or perhaps, I forgot, every diet you get their own spin on it, maybe someone who has a PhD in nutrition. But even with that, they believe that RDs should hold a monopoly over practicing nutrition. Maybe monopoly is not the correct word. Maybe just that RDs are the ones supposed to be dealing with nutrition for people, particularly medical nutrition therapy. And this is where I disagree with many RDs. Many RDs think that they should have this hold on practicing nutrition, but I don't agree for all cases. I believe that RDs should be the ones that are dealing with medical nutrition therapy. They should be the ones dealing with all kinds of nutritional practices to prevent or deal or treat medical conditions. I mean, the last thing that I want is a bodybuilder that read a few PubMed studies to write enteral and parenteral nutrition orders in a hospital, to write diet orders of any sort, to deal with medical nutrition therapy, whether in an outpatient setting, whether it's at the VA, the armed forces, a hospital, a nursing home, a skilled nursing facility, a prison, etc. School food service management, institutional food service management. I don't want some person that just read a few books about nutrition and all of a sudden thinks they're going to know what to do in a professional setting. Your standard institutions of work, 40-hour work weeks. No, that there has to be some standard for that. We have to have RDs doing that. And anyway, nevertheless, most people who are interested in body composition, bodybuilding, sport nutrition, are not inclined to take those jobs up anyway. They don't have the personality. It's not something that would interest them in the slightest in the first place. I happen to work in a skilled nursing facility, and I've done so for all my dietetics career except for 2 hospitals that I worked at. So, there you have my take on it. Even with private counseling, I think an RD should be the one dealing with the treatment of medical disorders and morbid obesity. So with that out of the way, let's get on to the other people. Now, let's just get back here, actually. Let's go into what an RD is and what kind of credentials and what kind of schooling they had to go through. An RD has to take a 4-year degree, complete a 4-year degree, a didactics program in dietetics with certain core work, certain life sciences such as biochemistry, microbiology, chemistry, organic chemistry, what else is there? Preparatory math, biostatistics. Then there's a whole slew of the actual nutrition courses such as medical nutrition therapy, food service management, food science, medical nutrition therapy, nutrition communications, food and culture, nutrition throughout the lifestyle. I think it's one of them. Maybe that's called contemporary nutrition. Let's see what else there is off the top of my head. There were so many nutrition courses I took. But, and then, you have to go through an internship, and the rotations that I took in my internship were institutional and school food service management, acute care, which would be was a hospital, outpatient. I had an elective in sports nutrition. I wanted long-term care, skilled nursing facility, and maybe one other. But the internships last anywhere from 6 to 12 months, and after the 6 to 12 months, they have to take the RD exam to become a registered dietitian, and many RDs go on to take a master's degree. So, there is a great deal of schooling involved, and anyone with half a brain can respect this, actually. So the next time you look an RD in the face and say, but you don't know this and you don't know that, I think that you should realize who you're speaking to, because I've even had that thrown my way. And, they'll throw little zingers out, maybe. I mean, this used to happen in the past more when I've just, come across some people in the gym or whatever saying, well, RDs don't know this and RDs don't know that. And I'll say to them, I would ask them, okay, since you are the expert on what a dietitian is, why don't you rattle off the coursework to me? Tell me every class I've taken. Tell me what I don't know. What don't I know? Tell me what we don't know. See, then it becomes a little more difficult. Then you realize that maybe this person doesn't know what they're talking about. But I'm not going to say RDs are experts in every form, every aspect of nutrition. And this is why I do empathize with the other people who want to practice nutrition simply for general health and bodybuilding. Because I believe that, let's say someone wants some general advice for performing better or entering a physique or bodybuilding show or fitness competition, really all that's needed is a really minimal knowledge or expertise in nutrition to counsel someone to get ripped and to build muscle and to perform better. I mean, let's say if I just judge it with my hands, this is the amount of coursework or academia you would have to go through to be an RD. This is how much you need to know to build bigger muscles and get ripped. Contest prep coaches, this is how much you need to know. I want to be a contest prep coach one day. Once I make my bones by entering a show myself and getting down to single-digit body fat myself. But this is all you need to know. Basic. Anyone see a diet written by a prep coach? Anyone see a diet, an ebook perhaps on contest preparation? It's very simple. You just have to know how to manipulate calories, carbs, protein, and fat to get someone into shape. I mean, you have to use your ingenuity. You got to know what's going on. I mean, someone like Shelby Starnes or Chris Aceto, who actually has an undergraduate degree in nutrition, or Scott Abel, or my friend Stu Yellen, These are very knowledgeable guys, but really, even them, I really believe, being as smart as they are and well versed as they are, they're using this much nutrition knowledge to get the person in shape. They go by photographs, they meet the people they deal with, they see what's up, they see their weight, they see their body composition before their eyes changing, and they make adjustments based on what's going on. But that's it. You set a carb amount, you set a protein amount, you set a fat amount, and that's it. They're not managing medical nutrition therapy matters. So that's where, I mean, to me, if you're going to get shredded, you got to get in shape. Go to who gets the job done. Whether it's with someone who calls himself a personal trainer, or a contest prep coach, or a bodybuilding coach, a guru. I forgot to throw Dan Duchesne in there, actually, who was a guy who, although did not have formal nutrition training or academic work, I was even reading his books before I got my nutrition degree. I learned a lot from him on anabolic drugs, nutrition, bodybuilding. Not that I am going down that assisted route. You could check my TRT video to see what I'm about. And these guys really did have smart stuff, but really it just doesn't take that much to counsel someone to get in shape. So I'm really going to go with the premise that, like I said in the beginning, just to wrap this up, is that RDs should have the professional roles in the roles that I said before, the clinical aspect, or even, let's say, not clinical aspect, whether it's food service management in an institution such as a nursing home or a hospital or armed forces or a prison or a school, and taking care of medical nutrition therapy in the hospital or in an outpatient setting, or even just through private counseling. And we know what the medical nutrition therapy issues we're talking about with renal patients, morbid obesity, diabetes, nutrition support, whether it's a tube feeding or being fed parenterally through an IV, and that's where it's at. But I do not think that we should have some stranglehold on what everybody should be doing with their nutrition knowledge. Just so long as the prep coaches or personal trainers are so-called nutritionists, and I just might have to be called a nutritionist. You just have to title yourself a nutritionist. You could be a nutritionist tomorrow. Just say you're a nutritionist and build your website and hold a shingle out, and you too could become a nutritionist. And I'm not even being sarcastic. I'm just telling you what it takes to be a nutritionist versus what it takes to be an RD. But I got great respect for many nutritionists out there, especially my close friend, Stu Yellen, who happens to be a nutritionist himself, for bodybuilders, that is. And like I suggest, and he does, he simply has a disclaimer saying that he's not an MD or a dietitian, and that his knowledge and expertise in counseling has nothing to do with medical nutrition therapy. So that's all I got to say, guys, and I hope you enjoyed this video and that you can respect my opinion, because I am very open-minded. I'm a gym rat myself. I love bodybuilding, so I see it both ways. So have a good day.